Good afternoon. So first, let me read this quote. I don't think anybody other than me and my team realized the emotional toll of this job. So this is an extract from an interview I conducted with a museum practitioner working with people living with dementia. So what is this emotional toll? So when I was studying for my MA, I came across a research that identified museum well-being activities to emotional labor. And this research also highlighted that this work could pose a risk to practitioner health. So because I have a background in psychology and in human resources, that caught my attention, and I decided to look for other research on the subject. And I found that all this research shared the same conclusion, that support for emotional labor is critical. So I decided to explore how this recommendation had been implemented in museum and heritage organization. And last summer, I conducted a research with practitioners working with people living with dementia. This is going to be the subject of my presentation. Before, let me share some context. So in 2016, the National Alliance for Museum Health and Wellbeing conducted a survey, and the people living with dementia were listed as the second largest audience for health and well-being activities. And with a projected increase of 78%, which is huge, by 2040 of the number of people living with dementia, there is clearly a need for these activities. So, and who's at the front of this? The practitioners. Yeah, so their role is really important. Sorry. So now I want you to imagine that you are living with dementia. So you might lose your ability to carry out daily tasks, or you might struggle to engage in conversation. And for you, when you engage with these dementia activities, what is really important is to feel safe and supported. And this is the role of the practitioners facilitating those activities to maintain the right environment during the activities. That might sound easy, but it requires the practitioners to perform what is called emotional labor. And to do this, the practitioners must work on their own emotions. They must control their feelings and, if necessary, suppress negative feelings to present a friendly and smiley face throughout the sessions. They must also read the participants' emotional cues to ensure they have the right behavior with them and to support their emotional needs. And they must do that, so work on their own emotions and on the participants' emotion whilst leading the activity. So you might think, well, what's so special about this work? Other roles in museum and heritage also have to perform emotional labor. For instance, people working in visitor services or museum educators. What's special with this work is that you are working with participants who are vulnerable. And this gives the work the dimension of care. It's a fairly recent, care work is a fairly recent focus for museum and heritage. And it is a work that requires specific support for those performing it, because it could put practitioners at risk of emotional exhaustion if not properly supported. So now I'm going to share with you the main findings from the research I conducted. So first, a brief introduction to this research. The focus were the practitioners working with people living with dementia. And the objective was to explore how the recommendation to support practitioners with emotional labor, how this recommendation had been implemented in museum and heritage organization. So I worked with 6 organizations and I conducted 18 interviews. And each respondent was asked to comment on the role of emotional labor, to share their perception of the support available in their organization for emotional labor, and also to put forward their recommendations. So my initiative, my research was well received, and this confirmed my intuition that this was an area in need of focus. So this research generated 3 main findings. The first one is that is a confirmation that emotional labor is central to the work of practitioners working with people living with dementia. And it is also a confirmation that this work could pose a risk to their health if not properly supported. And to illustrate this, I'm going to share with you 3 extracts from the interview I conducted. I think it's probably the most important thing to manage, said one. It is hard when you do have other things going on in the background, whether it's at work, at home. It takes a lot of effort and energy to be that positive person. And the third person I interviewed said, I do feel it's quite draining. So I think this speaks for itself of the emotional toll that some practitioner can experience when doing this work. So the second finding is that there are 5 main factors impacting emotional labor. The first one, the activity location. So the activities can take place on site and they can take place off site in hospital wards, daycare centers, or resident homes. And when they take place off site, practitioners have less control over the session's delivery conditions. So they might have organized, for instance, an activity for 6 people and need a table and think they will have 2 carers with them. And they arrive at the care home and they are told, well, we need you to run that activity for 12 people. And actually you won't be having a table. You have to use that small room and there's only 1 carer available. So that can be quite stressful. Frequency of contact with participants. When the sessions are running regularly, this tend to be conducive to bonding between practitioners and participants. Practitioners start to care for participants. They know about them, they know about their family, they meet their carers, and they continue thinking about the practitioners after the sessions. Practitioners' professional background and experience. So because this work takes place with vulnerable people, and it's, as I said, it takes the dimension of care work, whether a practitioner has experience or training in providing care work is important. Practitioners' personal experience of people living with dementia. If practitioners have to care in their home for a relative living with dementia, it means they have to perform care work at home and then at work, and this can be overwhelming. Sorry. Oops. The quality of the team relationship. Do practitioners feel that they can rely on their team for support, or do they feel they're alone in this? That's another important factor. And the third main finding from this research is that support for emotional labor is multifaceted, and I've organized this support in 3 main categories. So first, emotional support. This is mostly about listening to someone's concern and providing a safe space for them to offload and express their emotions. So support for this could be, for instance, team debrief, peer review after a session. The second type of support is informational support. This is about providing practitioners with useful information here about dementia to help practitioners understand the condition of the participants they're going to run the session with. This could be, for example, dementia awareness training. It's also about providing key information to practitioners to help them look after their own health and well-being. So that's, for example, for practitioner, stress awareness training or resilience training. And the third category of support is instrumental support. This is mostly about providing practical help with the session's delivery conditions, especially if they take place off-site. So it's, for example, agreeing on terms and conditions with the care centers and agreeing on the number of participants for the sessions, how they will run, what material or support is needed, these sort of things. But it's also about providing a professional counseling to practitioners, for instance, providing clinical supervision with a psychologist. Some organizations have organized this sort of support. So with these 5 factors impacting emotional labor and these 3 categories of support, I'm proposing a framework to assess the emotional demands placed on the practitioners and to address those demands. And I believe that museum and heritage organization should have formalized support strategy for this kind of work. And I'm proposing this framework as a toolkit to design and implement individualized support programs. So not one size will be working for everyone, but having a sort of structure and then adapting this structure to every practitioner and throughout the years, because the practitioner's personal situation or their team might vary. So being aware of that and not saying this is set one for all and that's it. So I think this is really important this is one of the elements for the sustainability of museum and heritage wellbeing practice, is to look after the practitioners, because again, this care work is not the work that museum and heritage are used to. This is a fairly recent focus, so we need to really take care of those practitioners. Thank you.